Welcome to the College Connection podcast, a podcast presented by the College of Registered Nurses of Newfoundland and Labrador. This is the College Connection podcast.
Welcome to the College Connection podcast, and welcome to the first episode of our new season in our studio. My name is Kelly Kane, and I am a nursing consultant with policy and practice at the College of Registered Nurses, and also a registered nurse.
Hi everyone, I'm Michelle Carpenter. I'm an RN and also a nursing consultant with the college.
The College Connection podcast is made available for RNs and NPs as a resource to promote good practice and to highlight the importance of regulation in healthcare. For our Season 3 premiere, we have a special guest, Dr. Lee Chapman, the Chief Nursing Officer of Canada. Welcome, Dr. Chapman.
Welcome. Thank you so much. Thanks for having me.
Thanks for so much for being available to meet with us today. It's a pleasure to speak with you.
Likewise.
Before we get into your role, we would like to provide you with an opportunity to introduce yourself personally.
Well, thank you for that. I am a registered nurse from Ontario. I have been a nurse for just over 20 years now and have worked clinically in a variety of sectors, initially starting my career out in critical care during SARS in 2003, and then working in a variety of sort of policy and academic roles. I did work at the provincial regulatory body for nurses in Ontario, the College of Nurses of Ontario. I also worked at the Professional Association for Nurses in Ontario, the Registered Nurses Association, and both of those roles gave me really good exposure to sort of nursing across different sectors, but also nursing across the country. I think policy has been the common thread throughout my career, which makes sense given the role that I'm in now as Chief Nursing Officer for Canada. It's very much a policy-driven role. I still work clinically in a supervised consumption and treatment site in Toronto, and have taught nursing, I think, at all levels except for the PhD, but really have been championing the profession and all of the myriad different things that nurses can do throughout a very full career. It's such a wonderful profession. So that's kind of a Coles Notes version of me.
Absolutely. Dr. Chapman, that's really interesting because we talk to nursing students, we go into the first year, and we talk about all the possibilities that nursing can offer and across the different domains of practice. So you're a great example of what a nursing career could be like. So that's really great. Kelly and I, as registered nurses, remember a specific moment when we knew nursing would be our career of choice. Did you always have an interest in nursing, or was there someone or something that steered you towards the nursing profession?
It's a good question. My mom was a nurse, so she's now retired. But I think that like any typical probably adolescent child wants to do the opposite of what their parents do. And so very much, nursing was not what I wanted to do. In fact, I did an initial degree in Spanish and anthropology, which I think highlights my interest in people and languages. And to me, then going into nursing and eventually, working in regulation early in my career was like learning a new language. And so, that affinity for people and language is kind of what brought me to nursing. And so I was, I think, nursing avoidant initially. And then, once I started my nursing education program, I thought, this is such a great and holistic profession, and there's so much that you can do. And certainly I never imagined spanning all of the different domains of practice, but also, working in such roles that are sort of provincial in scope and now national in scope. But it's nursing is kind of the gift that keeps on giving. It's just there's so many things you can do in the nursing profession, and certainly my mom's practice, I think, as an operating room nurse in Ontario was a very transformative, I think, in shaping my beliefs about the profession.
Well, that's really interesting. Thank you.
And Dr. Chapman, you did provide us with with an overview of your career journey. Could you talk very briefly about your current position and title? And I believe Michelle is probably going to get into a little bit more details about your role, but can you just provide, some very introductory information, I guess, with respect to your role right now?
Sure. Yeah, absolutely. So the Federal Chief Nursing Officer role has existed in Canada since the late 60s, and it was then eliminated in 2011 under Harper's Deficit Action Reduction Plan. But until that time, there was a very robust Office of Nursing Policy. And, then fast forward to when the role was reinstated in 2022, that was really the result of advocacy from within the nursing community. Canada is a rich nation when we think of ourselves on a global scale, and about 70% of countries around the world have a government chief nursing officer. So it's really important that perspective be reflected in decision making at the federal level. And I do have to, definitely mention that it was the result of advocacy, because I think sometimes nurses advocate for things and think, nothing will change. And it really was that advocacy that led to the reinstatement of the role.
So, Dr. Chapman, as you stated, your title is the Chief Nursing Officer for Canada, and it's one of, if not the most significant leader positions a nurse can hold within healthcare. For those who may not be aware, what's the general role of the Chief Nursing Officer for Canada?
It's a great question. And I just want to say that, I can only be effective in the role, Michelle, with the representation of, 466,000 nurses across the country who are, I think, doing really essential work. And in many ways, I get to reflect some of the wonderful things that they're doing in my role. So, I am within the strategic policy branch of Health Canada. So it very much is a policy role. You can imagine there's lots of policy within this branch, and anything from medical assistance in dying to long-term care standards, controlled drugs and substances, virtual care, all kinds of things. I've been very focused on the health workforce priorities within the Health Human Resource Task Force. So policy is a major component of the role, and ensuring that nursing perspective is reflected in decision making at the federal level when it comes to nursing policy. We play a convening role in healthcare. As you know, we fund healthcare, and I have to say it was just yesterday in Corner Brook that Newfoundland signed their bilateral agreement, which pertains to the health funding transfer. Federally, we fund healthcare. How it is organized and delivered is very much up to the provinces and territories, and that bilateral agreement was signed yesterday in Corner Brook. And then lastly, I represent the government, both within Canada and internationally, though most of my work has been domestic since I started in the role. But I will be attending the World Health Assembly this year in Geneva as an opportunity to be part of the Canadian delegation representing nursing. So
that's a great opportunity. So great.
Yes.
I wish you all the luck in that. And yes, that was a great news story that we had yesterday. So thanks.
So Health Canada is a very large entity. And I know, Dr. Chapman, you just mentioned that you're with the Strategic Policy Branch.
That's right. Yes.
So, I assume that there are many different branches or divisions within Health Canada, and there must be varying responsibilities. How does your role connect with the, with the other branches and the divisions within Health Canada?
So, anything that requires a nursing lens, if it's, at any level of government, I'm essentially that resource. And so one group that I have also convened is what we call the federal nurse executives. So federally, we also have a large nursing workforce. If you think of, 10 provinces, 3 territories, but then also federally, there are many there is a whole nursing workforce. So Indigenous Services Canada, Correctional Services Canada, Veterans Affairs, Public Health Agency of Canada, ESDC, Canadian Armed Forces. I hope I haven't forgotten any there, but we talk about issues that are common within the federal departments or federal government. But, anything that would require a nursing lens, whether it's within the strategic policy branch, anything that the ministers are doing that needs a nursing perspective, if they desire a nursing perspective, even up to the Prime Minister's office, like anything that requires input on nursing, or that nursing perspective would come to me. So you can imagine it could be extremely broad, but I think the nursing lens is in fact broad. Like if you think of the holistic, parts of nursing practice, there's so much that nurses can do. And I think I've really benefited from creating a strong network of the nursing community really across the country throughout all of my engagement since I was appointed into the role in August of 2022.
Wow, thank you.
So when traveling across Canada, what would you classify as a particularly poignant or substantive occurrence that you've witnessed?
Well, I mean, I spent some time on Baffin Island in Nunavut, and I think one thing that really struck me, I was in a community called Pangerton, which actually has a bit of a TB outbreak right now. And I really wanted to see when they were doing a medevac. And so I was able to actually, go. I'd spent a lot of time at the nursing station, but I also wanted to actually see the medevac plane. And it was, in fact, 2 nurses from Newfoundland who were doing the medevac that day. And I think that really struck me because they talked about how they loved this autonomous practice of essentially caring for people in a plane. It really made me think of nursing from a pan-Canadian perspective because, although we may be preparing nurses in one jurisdiction, we have this really hypermobile workforce, and I think, nurses are doing miracles every single day in healthcare, including, a medevac on a propeller plane to get to Iqaluit, where you can transfer to a jet to go to an urban center in the southern province. Like, this is all done really at the hands of nurses, and I think when we can focus on a lot of doom and gloom, a lot of really bleak stories in the profession. But I think, every day there's wonderful things happening in the profession. And I think that example, I mean, there's so many examples, but that one in particular really made me think that nursing does transcend borders in our country. And, it's just wonderful to see how autonomous nurses can be if we allow them to be autonomous.
Absolutely, yeah, and it never ceases to amaze me, the different areas of practice for nurses, right? And then, the different domains, but also, the things that they are doing autonomously is, it's quite amazing. Yeah.
Absolutely.
Yeah.
So Dr. Chapman, we know that there are challenges within the healthcare sector, and that's a reality now. It's a reality across the globe. Certainly, we see it here in Canada and Newfoundland and Labrador. How are some of these challenges being addressed, and do you feel progress is being made?
I think starting with the last half of your question, I'm an optimistic person. So I think that I like radical change. I'm not going to lie, but I think that we live in a world of incremental change. And sometimes you just create this window of opportunity and you can, advance something really quickly because all of the conditions are ripe for change. But generally policy, especially healthcare policy, moves kind of along incrementally. But we're at this time where we need massive system change. COVID really was this unveiling, right? In terms of, how we needed to pivot and adapt our systems, how we needed to actually, change our response to ensure that we were providing care to people in Canada, and really change on a dime. So I think that, a lot of there's a lot of work to be done. There's no question. I think there is focused commitment. So at the federal, provincial, and territorial health ministers meeting on Prince Edward Island in October, there was consensus really from the FPT ministers on what was needed in terms of the health workforce priorities, focusing on retention, on education, supply and demand, on integration of internationally educated nurses, on better data. all of these things are consistent areas that need focused attention. And so we have, everybody kind of rowing in the same direction, respecting that healthcare is, funded federally, but organized provincially. So this is where, there's no one size fits all approach to healthcare in Canada. We need, nursing in Newfoundland and Labrador to respect the unique needs of the geography there. When you're on an island in the middle of the North Atlantic, and in many rural areas, care needs to be organized in a particular way. And only those of you from Newfoundland know what, and Labrador know what those nuances are. But I think there's, I mentioned the bilateral agreements. We have a historic investment in healthcare in Canada. We have lots of folks who are very committed to making durable changes in the health system. And so despite the bleakness, I think there's tremendous hope and optimism. And I think we often focus on the negative aspects of the pandemic, but in many ways, the pandemic also revealed many opportunities, those like glimmers of what we need to hold on to. And that's what we need to lean into in terms of changing the system and not going back into our comfort zones or our silos. We need to still find those opportunities for collaboration and really breaking down a lot of those silos or bureaucratic barriers.
Absolutely. Mm-hmm. And you're right. I think COVID did open our eyes that, there are many opportunities to improve healthcare in Canada. And being an optimistic person, you said, I'm going to now switch the question to what do you think are the greatest strengths and opportunities in healthcare at this time?
I mean, I'd be remiss if I didn't say we have more nurses than we've ever had before in Canada. I think that's a tremendous strength, and that is probably something that's really important for registrants and members to hear because we often talk about nursing shortage, and certainly we're existing in the context of a global nursing shortage, but we have more nurses than we've ever had in Canada. It doesn't mean we have enough, but certainly we have more, and I think that's a strength in terms of nurses being most proximal to the point of care, and really having a key role to play in all of those holistic aspects of care. I think that there's a lot of strengths in, in the provincial and territorial structure of healthcare. I know it's coming up to a year now that Newfoundland and Labrador moved to a health authority model. And so, having the province figure out how to organize healthcare is essential. And working very closely with post-secondary institutions, of which are, of course, provincially funded. But I think those are all strengths. I think we certainly have a lot of areas for improvement in terms of access to primary care and kind of upstream solutions in the system. But I think there are some great strengths that we can capitalize on as we're hopefully modernizing our health systems in Canada. In many ways, we have 14 different health systems. So 10 provinces, 3 territories, plus the federal government. And so we can all learn from each other, and there's great strength in that.
Yeah, for sure. And I guess the analogy is, we work within, as healthcare professionals, we work within, collaborative teams. But I think with all the partners, we need to work within a collaborative team and work together to come up with solutions to meet the needs of our population across Canada.
This is it, exactly.
Dr. Chapman, healthcare is continuously evolving, as you know, and as you were just kind of explaining there in the previous question. We hear phrases like collaborative care teams, RN prescribing, virtual nursing practice. These terms, while virtual nursing practice has been around for a while, we're hearing it more and more often now, and that's probably, again, due to the COVID pandemic. How do you see these initiatives working in Canada and also notably in Newfoundland and Labrador?
Yeah, I think that with regards to collaborative care teams, this is kind of the sandbox that we all play in, right? This interdisciplinary, interprofessional milieu. I think that there's, and those teams keep getting expanded. It seems like more and more diverse professionals are joining these care teams, including patients, families, residents, and caregivers. And I think that's wonderful, and it's ever more important for nursing to be able to clearly articulate that unique and uniprofessional contribution to care. There's no doubt that there are overlapping scopes, but it's very important for nursing to be laser focused and crystal clear on, what is the nursing scope, what is the nursing contribution to care within that collaborative environment. Virtual is a great example of how care does transcend borders. If you think of the Atlantic region, there's a lot of care that is really regionalized across the whole region. And I think this, of course, we need those who are providing care to be licensed or registered in the jurisdiction in which they're providing care. But I think it shows us how, we can pivot and we can adapt our systems. Virtual care really skyrocketed during the pandemic because of all of the system challenges, but it hasn't gone away. And so it's something that we need to think about how we can even adapt regulatory structures to be nimble to adapt to the virtual care. And RN prescribing, I think, is a real opportunity. We've been talking about this for decades, I think, in Canada. It's interesting because we're seeing a lot of prescriptive authority with pharmacists being able to prescribe for specific conditions, and that's great. We need all hands on deck, but we also need to advance RN prescribing, and I think this is where that strong professional voice is needed. But there's obviously a regulatory component that it's really important to ensure that there are robust, regulations and standards that nurses know that they can adhere to, they need to adhere to when it comes to RN prescribing. In Newfoundland and Labrador, you're an island in the middle of the North Atlantic. So, although it's very easy to get there, we need to really think about how care can be optimized, how your workforce can be optimized. And so thinking about, the role, for example, that nurse practitioners can play, particularly in rural and remote parts of Newfoundland and Labrador. And it's not to say that, there isn't a role for others, physician assistants and so on. But again, this is really an opportunity about providing access to those who need care. And as I said, we need all hands on deck at this time. There's lots of room for everybody at the health workforce table.
Mm-hmm. So I'm glad you talked about nurse practitioners, because this is where my next question is going to lead into.
Okay.
And it's very timely because, the workplace or work environment is ever evolving with, different challenges and different client needs. So the college is responsible for establishing the scope of practice. And in recent years, the scope of practice for all healthcare professionals has expanded, but in particular for nurse practitioners. So how will expanding the scope of practice for nurse practitioners benefit the public and the system overall?
I think that, there's no question that nurse practitioners play such an essential role in the system. And I think expanding the scope will mean that they can be, they can work in rural and remote emergency departments. I know part of the expanded scope with the changing entry to practice requirements coming out this fall includes airway management. So I think nurse practitioners themselves will feel more comfortable in rural and remote emergency departments, which is often been vulnerable to closures because of some of the health workforce challenges. And so I think nurse practitioners, there's been tremendous growth in this category of nurse year over year, but also sadly, some underutilization. And in fact, many nurse practitioners I've spoken to are, working as RNs because they're not able to be optimized as a NP. So I think having scope changes really does increase that opportunity for them to be providing care autonomously, but also collaboratively in rural and remote parts of the province, for example. And I think it's really important in making scope changes to ensure that those are communicated to the public as well, because there is sometimes a real lack of awareness with the public around what the difference is between a nurse practitioner and a family physician. And now more than ever, we need that clarity of where the roles are unique and autonomous and where they are overlapping and collaborative.
Well, that's a really great point. Thank you for pointing that out. Thank you.
You mentioned earlier in the episode that you have some experience in nursing regulation, and as well when Health Canada did their news release about your appointment in August 2022, it was mentioned that you have experience in regulation. Can you elaborate a little bit about that?
Yeah, so it was, I was a critical care nurse and really focused on being the best critical care nurse. I liked all the bells and whistles of critical care nursing, and ended up by absolute fluke doing a placement at the College of Nurses of Ontario. So I was a TA for a teaching assistant for a course. The guest speaker happened to be the president of the college, and I was introducing her and said, do you think I could get a placement? I need a graduate practicum for my master's, and ended up at the college and had no sense of where the college was really, besides where I sent my money, and at the time, where I paid money to essentially pass my licensing exam. And so, boy, did I ever have a lot to learn, and I absolutely loved it. So at the time, there was a lot of work being done across the country, and as I understand it, was the first time that the jurisdictions were really collaborating on changing the entry to practice requirements for all categories. So a nurse practitioner was moving up to the master's level, the RN programs were moving to the baccalaureate level, and the practical nurse programs were moving up to the community college diploma in most jurisdictions, with the exception of Quebec. And that, I went from really looking at nursing at the point of care in a critical care unit where you're, impacting a patient family, maybe your colleagues in terms of the unit culture, and then looking at nursing at a provincial and pan-Canadian perspective. So that work on entry to practice was really so interesting, because it involved working, as I said, with others from across the country, but then also with all of the faculty members. And what was interesting to me was this, we went from, in nursing education, at least in Ontario, we had a skills checklist at one point in the 80s, to then moving to this competency-based model. And so socializing the concept of competencies being implicit in curricula, but then having the faculty be able to, choose how they were going to integrate the competencies into their program. And that really reflects the diversity, I think, of nursing education. But to me, it's an example of how any change, even if positive, this is something Canada as a nation, we've wanted these changes in entry to practice since the 70s. So these changes were happening in the early 2000s in most jurisdictions. And it was still a bit of an unpopular change because it involved so much work. It involved collaborations at the time between community colleges and universities. It involved massive changes to curriculum, and it just involved all of these changes that was a lot of work. And I think, fast forward over 20 years later now, I don't think have looked back. We've, hopefully we don't never reach a point in Canada where we say we need to actually go back to different models of education. Patients are more acute, and they need, more sophisticated care. And I think that it's really important to ensure that we have entry to practice that meets the needs of the population, entry to practice competencies and requirements that meet the needs of the population we're serving. So that it was a really I guess, formative time in my career, and really kind of opened my eyes to a whole different world, and certainly really understanding the nuances between what is in regulation, what's in legislation, and then what's in bylaws or operational policies within a college, and what your levers are for change and how you enact change within those constraints, and especially considering regulatory bodies are arm's length of government. So again, working very adjacent to the provincial government and needing to be in lockstep.
Absolutely. And for me, I am new here at the College of Registered Nurses of Newfoundland and Labrador. I started about 6 months ago, and I can definitely relate to a lot of what you're saying there, a huge learning curve. And, I particularly enjoy working with other jurisdictions and networking like that, and getting to speak to people like you as well. So, but yes, definitely a learning curve. And the world of regulation is something that, as a practicing RN, it wasn't something that was at the forefront of my mind a lot of the times. So, absolutely, I realize, how important regulation is within healthcare, from working with the college. But, we think about some of the registered nurses and nurse practitioners that are out there working every day, and doing episodes like this to try to get the, regulation out there and why it's important. So thank you for that.
Yeah, well, absolutely. I can relate to your story too. I remember.
And I loved your your example and how you talked about your work with that regulation at CNO, because I'm responsible here as the nursing consultant for policy and practice for education approval, and I also sit on a national committee, the Nurse Practitioner Regulation Framework Implementation Plan that just updated the NPELCs. Yes. So when you talked about that entry to practice and needing them to be updated to meet the client's needs, I think that was a really important point that you made, that our ELCs, our entry to practice foundational knowledge, needs to be updated as society changes, as the workforce changes. Then we have to be reflective of the Canadian healthcare system and meeting the needs of clients, and we need to have that foundational knowledge. And what was 20 years ago is not the same practice as today. So I really enjoyed your explanation of your experience in regulation. So the next question is very important because it speaks to our role as the regulator. So the College of Registered Nurses, as I said, the regulator, often gets mistaken with being the nurses union or an association or advocacy group. While the roles of such groups are they're vital, why is it important to reinforce the role of the regulator?
Well, I think it's really important to understand that the regulator is there to protect the public, and as such is arm's length of government. And so, I think that, yes, nurses think that, well, if we're setting standards and scope of practice and entry-level competencies, wouldn't that be for the profession? But ultimately, they're guideposts so the public is protected and receives safe, competent care. And, the college is also there to enforce practice when there is egregious violations, enforce discipline, but also to promote quality assurance or continuing competence. So all of these things, setting the standards, setting the entry requirements, discipline, and quality assurance, or some variation on those sort of themes, is really all in keeping with that public protection mandate. So in that sense, colleges are arm's length of government. They get their authority from their provincial or territorial government. I think that, there is a separate role for the professional association to play when it comes to advocating for the profession. There was a time when we had, in many jurisdictions, colleges and associations in one house, but you can imagine the tension, right? Where you're advocating for the profession under the same roof as, potentially disciplining nurses or prosecuting nurses for egregious practice. It's a bit of a conflict. So I think it's important to recognize the unique perspective of associations and unions, certainly are really around the working conditions, the labor rights of nurses and working conditions. They all play a complementary role. And I think the one thread is that it is often nurses working in these contexts. And so having that that unifying perspective of nurses, working in regulation, also working in, professional association or advocacy, and also working with the union. It's nurses who work in those roles. And so reminding, I think, members and registrants and the public that, although the role of the college is to protect the public, it's nurses who are also setting, being part of that. And that's the essence of self-regulation. And that also provides, I think, solidarity to nurses who are working in different areas or different groups. Hopefully there's some comfort in knowing that it is nurses who have a lens on, for example, entry to practice competencies and practice standards and so on.
Absolutely.
Yep.
Yeah.
Great. Thank you.
When you think about the future of regulation, specifically nursing regulation, what comes to mind?
I mean, I think when I think of the future, I think we need to be ready, right, for whatever the future holds. And I think there is so much that we can't even imagine in terms of our future: robotics, AI, really probably virtual care beyond what we have now. There's the possibilities are really limitless, I think, in terms of how we modernize and advance healthcare. When it comes to the future and regulation of regulation, I think we can look to some of the changes that occurred in COVID as good as a signal check, perhaps, to some of the changes that will continue to be needed in the future. So, for example, across the board, jurisdictions, provinces and territories brought back more nurses to public registers than ever before. They reinstated nurses. They brought back nurses sometimes from retiring class. They opened up emergency categories of registration. All of these things were sort of enacted and enabled because of COVID. And I think we need more of that. We need more of that nimbleness and responsiveness to the changing needs of people in Canada. I think we talked about virtual care as well. That's another example that has continued, and really thinking about care and how we meet standards when they are across the screen, and there's all kinds of other considerations. I think, in terms of the workforce challenges that we're facing, it's very, it's very commonplace across the country to have no bed admits in emergency departments. And so thinking about, how can nurses actually meet the standards when they're practicing, hallway healthcare, essentially, and having, ensuring that there is awareness and almost that knowledge translation piece of regulatory standards, that they actually reflect the practice realities. Because if we're setting standards that really have no resonance with those who are providing care, we're going to have nurses who are just not meeting the standards, and that doesn't work for anyone. So just ensuring that responsiveness. So I think, those were a lot of examples, kind of a long-winded way of saying, I think the future of regulation needs to be nimble and responsive and adaptive. And that's often not the way, if we think of legislation and regulations, those things often are kind of perceived as immovable, right? But we moved mountains in COVID, and we need to continue to move mountains as we need to reshape healthcare in Canada. So I think nimbleness and responsiveness are kind of what comes to mind. I know the regulators, work very collaboratively across the country, and that is so positive. Despite the jurisdictional autonomy, that convening function is such an important leadership role for regulators to play. And, seeing what's common across the country and where requirements can be common, I think is really the way of the future.
Yeah, absolutely. And I think we've heard over and over now is that the regulator needs to be nimble and, sharing of knowledge across the jurisdictions. And, we are all looking at our policies and seeing where we can streamline so that we can increase harmonization and labor mobility, and so that, we can easily meet the needs of the population in a timely manner.
Right.
Thank you. So the role of the Chief Nursing Officer was eliminated in 2012 and then reestablished in 2022 when you took the position. Why do you feel it is important that policies and decision-making be viewed as with a nursing lens?
Well, I mean, the flip side is that we will have others making decisions for us, which,
Right.
in the profession, which can absolutely happen, right? And you can see how much of a slippery slope this could be if we had, decisions being made saying, oh, there's a shortage of OR nurses in this one jurisdiction. Why don't we just graduate a bunch of OR nurses only? And then they have, they're constrained by their practice environment. We really would have like industry setting requirements for the profession or decision makers who have no sense of, nursing is broader than any one particular area of specialization. I'm sure you can all attest to going in and out of different domains of practice, different areas of specialization. And so I think it's the essence of self-regulation to have nurses involved in decision making. And we are the largest group of health professionals in Canada and often most proximal to the point of care. So we have such a key role to play in understanding the system and understanding social determinants of health. And that nursing perspective is, often people say, if you fix nursing, you fix the system. So if we actually fix some of the issues that are plaguing the health workforce, if we fix them in nursing, it goes a long way to fixing the system. If you have happy nurses, patients receive good care, and if you have continuity, if you're retaining nurses, patients receive really great care and they're not boomeranging back into the system and costing more in terms of additional demands on the system. So I think, it's just key to have that nursing perspective reflected in decision making to ensure that we get it right for nursing across the country. And, that's we have to respect jurisdictional autonomy. And, I think we have to just work together collaboratively and play that convening function and bringing the players together, recognizing that nursing is, we're united across the country as a profession, right? And there's tremendous strength in that, despite the regional differences.
Absolutely. Thank you.
During your time in this role, what would be would there be a policy or an endeavor that you would like to be remembered for?
Well, probably the nursing retention toolkit. That was a big deliverable we just announced on March 4th. And, ever since I was appointed into the role, nurses said, she needs to convene a forum. She needs to bring nurses together. And that took some time to socialize within government because we were doing a lot of other interprofessional workforce initiatives or meetings or convening groups. And I think, we settled on the topic of retention because there was so much being done on recruitment. But of course, we know that unless we're actually finding these durable solutions to optimize the workforce, we have this continuous drain either out of the profession or out of the public sector. And we've seen that with the, exodus of nurses from the public sector into private travel nursing or agency nursing. And we need to just improve those working conditions so we can entice nurses back into the public system. So that's really, the retention toolkit is really about finding those solutions that are for the profession. It was the toolkit was created by and for nurses. We asked for 2 employer nominations per province and territory, and then for those employers to bring 2 frontline nurses. So we really wanted the frontline nurse perspective highlighted. And, as I said, just announced the toolkit on March 4th. So it's getting lots of traction, lots of uploads. It's on the Canada.ca website. But I think it's a key deliverable. Nurses are very excited about this across the country. They feel validated when they see its content because they think that these are things we've been talking about in the profession for some time. But to see it all in one Government of Canada document carries a lot of weight, I think. And so, it's up to all of us to ensure it gets implemented. But I think if and when it is implemented, it will make a huge difference. So I think that's, the one piece thus far. I mean, we'll see. Still have time in my term, but thus far that is absolutely like such a key piece that I really hope it's taken up across the country, and it will be assessed at the federal, provincial, and territorial health ministers meeting this fall. So hopefully we have some really good crunchy stories to tell about what a difference it made in organizations and health authorities and across the country. That'll be really important to share.
Yeah, absolutely. And that was a next question that I had for the retention toolkit. So it's a toolkit that can be used by provincial governments. Is that correct? As to retain nurses?
Yeah, by employer. It's really aimed at the structural or system level. So by provincial or territorial governments or health authorities or employers. Some employers are, or healthcare organizations are taking it and using it within their nursing practice council or their nursing advisory council, using it sort of as a benchmarking. What are we doing well? What do we need to improve upon? And there's lots of examples in the toolkit of where these things are already done across the country. And so we hope that these can be scaled and spread.
Absolutely. Excellent.
I think it's an exciting time and very timely. And we can share a link to that toolkit on our podcasts platform as well, Dr. Chapman. So we'll certainly do that. So to conclude, we had a question regarding the novice nurse who is viewing this and just fresh out of their program, is about to start their career. What words of advice would you offer them?
Oh, well, first of all, welcome to the profession for a novice nurse. They chose well. I certainly hope they know they have an ally within the federal government. And I would say to stick with it. There's no question that, entering the profession at this point, when your nursing education has been impacted by the pandemic and the workforce challenges, it's tough. And I want to acknowledge how tough that is and how bleak it may feel when you're packing your lunch and going in and, working nights and, dealing with all of the duress and challenges inherent in the system right now. But to be mindful that this is such a rewarding and broad career, that there's so many things you can do. And I think that, novice nurses often get perennially told, they either get told this or they obsess about it. Thinking back to my time as a new grad, you obsess about the things you don't know. You think about, whether you did this procedure right, whether you did this intervention right, whether you remember to document. And then you're often told that as well by colleagues of all the things you don't know. And I think, we need to really think about what novice nurses bring to the profession and the gifts that they instill. And that is really, I think, the richness. I hope that novice nurses know that they are enriching our practice, even for those of us who've been in the profession for several decades, we are really doing the public a disservice if we stop learning, and we need to learn from novice nurses as well. So I, welcome them to the profession and, ensure that they know that and trust that it will get better. We're working very hard. We know it's hard right now in the system, but we're working very hard collectively to improve things, and it will get better.
Yes, and we often say to staff, oh my gosh, we have to orientate a novice nurse. But I always say, just think about it. They're just graduating from the program. They have the most evidence-informed knowledge. You can learn from these novice nurses. So, to encourage and support them in their transition as an independent practitioner. So, Dr. Chapman, I'd just like to say it's an honor to have you here today and speaking with us. And it's been extremely informative. And we really appreciate that you've joined us today.
Well, and my pleasure, absolutely. Sorry.
Thank you so much.
Sorry,
and that concludes our episode with the Chief Nursing Officer of Canada, Dr. Lee Chapman. So thank you again, Dr. Chapman. And yes, I echo Michelle. I thought it was very interesting. I love hearing your thoughts about nursing and about regulation. It was excellent.
So thank you, Dr. Chapman, and thanks to our audience for tuning into today's episode, a conversation with Canada's Chief Nursing Officer.
Thank you so much for having me.